This would be lesson 1B, acting in an emergency. So a few things that we'll cover would be preventing disease transmission and what you need to do when you get onto a scene and how to protect yourself. So in order to be infected, you have to have four things. You have to have pathogen, so something that can infect you, like a virus or bacteria. Quantity, there has to be enough of it to actually infect you. Entry site, so your skin is protective to you. But so there has to be some kind of an entry site, and our most risky sites would be soft mucous membranes like the mouth and the nose and the eyes, and then of course an open wound. And then you have to have susceptibility. So if you have your innate immunity includes things like fever in your skin and white blood cells that would get rid of just kind of general infectious agents to the best of its ability, but also the adaptive immunity that we have from immunizations. So, for example, if you were immunized for hepatitis B, you could be exposed to blood that had hepatitis B. There could be plenty of quantity, and there could be an entry site. You could get it in your eyes, but because you've had the vaccine, you're not susceptible to it. So there's a lot of different types of things that you could get infected by, viruses and bacteria. And three of the main bloodborne infections would be HIV, Hep B, and Hep C, but there are a lot of other things that we would like to not spread from person to person. So we go with just general universal precaution, which means we assume that all bodily substances are infected, and therefore we use body substance isolation. I really do love that term. Yes, let's isolate the body substances. So we use standard precautions, which means we treat all victims as if they're infected, even though they are not. Standard precautions would be use personal protective equipment, cover any open wounds that would be an entry site, and then afterwards make sure that you use correct hand washing procedures and disinfection procedures if necessary. For us, we would typically have, as a bystander on an emergency scene, gloves, some type of barrier. For us, it's our emergency mask with the one-way valve. Other things that you could use would be eye protection, mask, and gowns, but again, most people don't have those things in the back of their car. When using gloves, it's very important, excuse me, most people can put the gloves on just fine. It's really, you have to be careful about taking them off. If I were on an emergency scene, I usually would wear 2 pairs of gloves, a double glove, because if there's so many rough surfaces, it's common for a glove to get snagged or broken, and then you have a second glove underneath. So I keep multiple pairs of gloves in my car. So washing hands, if you just really weren't exposed to anything, and then you can take the gloves off and they're clean, and then you can go ahead and wash with soap and water. If you were exposed to blood, it's very important that you would then go and start the decontamination procedures at the emergency room if the blood came into contact with your skin, eyes, mouth, anything like that. Now, most of you aren't carrying around a biohazard bag, but this is where anything that was soaked in blood should go. So a small Band-Aid with dry blood, no. Gauze with soaked blood, yes. But on an emergency scene, there would be the EMTs, paramedics, police, fire, and they could take care of anything on the scene that had to be removed that was contaminated. If there was something that you did need to contaminate, you should use a 10% bleach solution, which is 1 cup of bleach with 9 cups of water. So it'll be 1 cup of bleach per 10 cups of solution. And then you leave it on for 10 minutes. So the object should stay moist with this 10% bleach solution for 10 minutes. And that would be fully decontaminated. Lysol wipes are not a substitute. This must be a soaking wet kind of decontamination procedure. So in any emergency, the first thing that's just going to happen is that you recognize there's an emergency. The next thing that needs to happen is check the scene. And sometimes that's as far as you get, that you could check the scene. You could call 911, but you may not even be able to enter the scene to check the victim at this point. And for a lot of bystanders, their role on an emergency scene is just preventing other people from becoming additional victims. And so keeping people from entering an unsafe scene, getting traffic to move so the ambulance can get to the emergency scene. This may be the extent of your work at that scene. If all those things are taken care of, then yes, you would go in and try to give care to the people that need care. So when you check in the scene, you're looking for a lot of different things. You just use your common sense, scan the whole entire area, look for possible dangers, what might have happened, and then people who can help. We don't want people to run away just because you're there helping. You're going to need some additional help. People can get on the phone with the dispatcher, people can direct traffic, people can run for supplies. All these things can happen with help. Any type of a hazard means that you cannot enter the scene. So smoke, if there's fire, electrical wires, even the police and fire and EMTs will not enter a scene if there's downed electrical wires until they've been verified as with no current flow to those wires. If you have made it past the scene is safe, and you get to the victim, the first thing you're going to do is check for responsiveness. And we do this with the adult victim by tapping them on the shoulder and loudly saying, "Are you okay?" And for an infant, we would flick the foot and also say, "Are you okay?" This is giving them a pain stimulus by the tapping and a verbal stimulus with your voice. So they do need to be forceful, don't injure them, and loud to see if they respond to either voice or touch. We don't want to move the victim if at all possible, because in many situations there's risk of a head, neck, and back injury. But sometimes you do have to move them. We'll get to that later. We call 911. And here's the thing about calling 911. You can call 911 anytime and not get in trouble. So once you think there's an emergency, you call 911. If the person refuses care, you can still call 911. They don't have any control over whether or not you use your phone. So they can refuse the care once it gets there, but you can still call. If you get past calling and checking the scene and you give some care, it's important to follow a couple rules. Always do what you're allowed to do, or don't do things you're not allowed to do is really what I want to say. So if you're not trained to do some procedures, then you can't do them, like water rescue. If you're not trained for water rescue, you should not attempt water rescue. Also, in most states, you can assist someone with their own medication if it's prescribed to them and they can identify it as theirs. You can assist them, but you should not administer medication. So, for example, for this would be an EpiPen. You cannot use someone else's EpiPen on another person without being negligent. The EpiPen is dosed for that person's size, so it's important to only use a dose of a medicine that has been prescribed for that person. Using an adult EpiPen on a child or infant could be very dangerous because of the effects of the epinephrine on their system. So it's important that you could assist. I mean, this could go as far as an EpiPen with a person who's becoming very confused because of lack of oxygen. You could put their hand on the EpiPen and your hand over their hand and then help them to administer the epinephrine as long as it's been identified, again, as their epinephrine pen. And then another thing that has to happen is if people need medical attention, you need to recommend that they go and see additional medical attention, or call 911 and bring medical attention to them. This sometimes gets a little bit difficult in a situation where the victim or the victim's parents thinks that it's okay to just put them in the car and drive them to the hospital. You obviously can't physically stop them from doing that. That would be battery. But you can recommend that and explain to them why they shouldn't move the victim. If you think the child might have a head, neck, and back injury, if they have a broken arm, explain to them that moving them, those broken bone ends can sever blood vessels and nerves by moving them around in a car. So even though people are reluctant to pay the bill for an ambulance, it is important. It can be really important to call that ambulance, because again, the person might not need to move because of, like I said, like a broken bone. Sometimes there's some things to do after an emergency, and so obviously again, you're not going to be cleaning the area because the first responders would take care of that. You do need to stick around on a scene. You know, when the ambulance gets there, you're not number one priority, and so you just need to wait. And they may seem like they're not paying any attention to you, but you still need to wait. If you've given some kind of emergency care, it's important that you stick around. So sometimes when people have had to give care, if it's been a traumatic event, you can have signs of stress afterwards, and you can have stress right away. Most people have stress on emergency scene, no matter how prepared you are, because there's a lot at stake. But sometimes people have ongoing stress, critical incident stress, and so this can be delayed. And it's really any kind of stress that is interfering with your daily function in whatever way that it is interfering, whether it's sleeping, just your overall feeling of well-being, your ability to function. It can be all different types of levels. It's important to seek help. It is not something that you should have to go through alone. If you were a paid emergency responder, you would have post-incident debriefing where they're checking to make sure that everybody's okay. So as a bystander, we don't have that. So it's important that you do go talk to someone if you are dealing with stress of a situation. I've had a lot of students come back and talk to me after having given CPR or been on an emergency scene. They just really want that debriefing session where they tell me what they've done and I tell them they did a good job, and we talk about it if they're having any stress or dealing with the situation mentally. Sorry, I got a scratchy throat. So the stages of grieving and dying, and we're going to talk about this. Actually, I want to go back real quick. So there is no way to know what event is going to be traumatic for someone. And what I'm trying to say is that I've talked to emergency responders that do all types of emergency care, respond to all kinds of events every day. It's part of their job. And then one event just really was disturbing to them. It might have involved a child. It might have been involved someone they knew. So those are the kinds of things that make it a little bit more stressful, but you really can't tell. And so anytime you're dealing with stress, it's something that needs to be addressed. Okay, stages of grieving and dying. So we bring this up because you might be dealing with someone who is grieving for someone who has died on an emergency scene or appears to be dying on an emergency scene. And you may be dealing with a victim who is maybe in a very critical state, but still conscious, and or even a victim who believes that they are dying, even though you feel maybe they will survive. If they believe they're dying, they may head into the grieving, dying process as well. So first, let's talk about the bystander, so a loved one of someone who has either died, so the victim has died or is dying, and you've got the loved one with you, and they're going through the grieving process. So the first thing, our stages are denial, anger, bargaining, depression, and acceptance. Now, I'm probably not getting all the way to acceptance at that scene, But the first three, if you're looking at denial, anger, and bargaining, they can be this loved one could interfere with your ability to give care to the victim. And so the best thing to do when you're dealing with someone in those stages of grieving and dying is to say, I'm doing everything I can and more help is on the way. And that's what they've found is the best thing to say to comfort someone and allow them to let you do what you need to do. I'm doing everything I can and more help is on the way. Now, if they're in that anger stage, you may be their target. Not everyone is rational in the grieving stages. And so again, fall back. If you think your safety is in jeopardy, then you have to leave the scene. But most of the time, people, when you say those words to them, I'm doing everything I can and more help is on the way, will let you continue to do your care. Now, it is very important that you do not give false assurance to someone, a loved one, a victim that you think might actually be in very critical condition. And that is because even though they really want you to say that, they want you to say everything's going to be fine. But if you don't think that, then don't say that. For example, if you had a parent, the child is there, you know the child, you feel the child is in critical condition, and the parent is very upset, and you tell the parent everything's going to be okay, and they walk away to make a phone call to their spouse or to another family member, and during that time the child passes away. They don't get that time back. They can't come back to that time and be with the child as they passed away. And so it is important that you don't give false assurance, even though that, again, that is exactly what they want to hear. Okay, so now go to the victim. Now we're talking about a victim who is in a critical condition or believes they're in a critical condition, even though you may not agree. This is not a time for arguing either way. So most victims who are dying or feel they're dying will want to talk to someone and they will want company. Very few people want to be alone and silent during that time. So this is a time for listening, and you want to be empathetic, no judgment. It's not time for you to talk a lot unless they're asking you questions. So if they're talking, then just listen. When they stop talking, then it's okay for you to start saying comforting things to them, and just let them know that you're there with them and be very empathetic. And again, if you're dealing with a loved one, be empathetic, listen, non-judgmental, and don't give false assurance. Also, don't say you know how they feel. This is not a time to talk about experiences that you've had or been in, because they tend to feel that they're just the only one experiencing this pain. All right, this is a little bit morbid, but there are a few times that you do not need to go in and start CPR, excuse me. And that is if there's obvious death. And so you can't proclaim someone dead. Let's say you came on an emergency scene and they say, well, we've been doing CPR for 30 minutes. You can't say, okay, well, let's stop. It's not going to work. Even EMTs would have to continue CPR until they got to the emergency room and the medical director there pronounced the person dead or deceased. So there are a few times, though, rare, very rare, that you wouldn't have to start resuscitation. And that is if there's obvious decay. They have been dead for a little while. Rigor mortis, so the body is very rigid because of muscle contraction. This takes several hours to set in, so that means that they had been deceased for several hours. Please don't confuse that. If they've been like in a lake and it's freezing, then they're frozen. They're not in rigor. Obvious mortal wounds. So if any of the major organs are separated from the body, such as heart or lungs or brain, then CPR would not work. Also, if the head, decapitation is an example of something that you would not have to begin CPR. And then lividity is a difficult one. Lividity is blood pooling after death. So blood pools in the body after death based on gravity. So if they were laying on their back, then the purpley lividity, they look like bruises, but they're not. It's just blood pooling against the skin, would be on the back of the body because they were laying on their back. But again, it's kind of a hard sign to say that someone has that pooling. They'd probably also be signs of decay if that was present. Oh, it's a lovely conversation, right? All right, so that takes care of coming to an emergency scene and acting, and you have a study guide 1 that would go with lecture 1A and this lecture 1B.